must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
In Africa as a continent and indeed the globe. Fellow Kenyans, a few days ago, the World Health Organization warned that despite a million within 3 to 6 months, while this is a projection, it might as well be the reality in the coming days. Consider that this past week alone, we have seen significant changes of infections in our own neighborhood, where the COVID-19 cases in Somalia have multiplied 9-fold in a single week, from 26 cases on April 13th to 237 by yesterday. In our neighboring Tanzania, the numbers have swollen 7-fold, from 32 cases to 254 within the same period. These developments concern us. They might translate into frightening reality for the Horn of Africa. While what we are learning is that this virus transmits silently. Initially, it may move at a slow pace, but as we have also seen in countries such as Spain and Italy, it takes on such frantic speed that even the most developed of nations cannot catch up with it. Between March 18th and 25th, a span of 1 week, the cases in Spain grew 5-fold, from 11,741 to 50,019. Given these realities, the general sentiment of comfort we are witnessing is severely misplaced. When we as a nation are complacent with a few officials exploiting this pandemic for personal gain, or conversely, the idea that we can break curfews and not suffer any ramifications, then we know that we are heading in the wrong direction. And indeed, there is nothing to celebrate when runaway impunity takes place at the risk of all of us. As a government, our planning and actions are informed by global trends and our own analysis. A slight lapse in behavior, like the ones we have witnessed in the last few days, could roll back the gains we have made so far, and by implication, the destiny of our nation. The days when everything was left to the government are long gone. This disease is now calling for our total and divided commitment and unity. While I appreciate and acknowledge the cooperation by many Kenyans, I must say that there are a few Kenyans who deliberately rebuke the efforts that we have put in place to contain the spread of the virus. Our daily update briefings have served to rally Kenyans to their individual responsibilities, while at the same time painting the picture of our situation.
A very good afternoon to you, our viewers, and thank you so much for being with us again. We had an earlier broadcast which experienced some technical hitch, so we had to stop abruptly, but we are back now, and I shall complete the part of the Kenyan news that I had not completed, where we were highlighting some of the guidelines that has been put in place by the Ministry of Health here in Kenya, courtesy of the Secretary for Health here, Mr. Mutahi Kagwe, indeed in partnership with the national government and of course other measures that have been put in place. So we shall just complete with that shortly. And not so much was left, and then we will get into what else is making news across Africa. We've not heard the diaspora dispatches for a while now, and so just keep it here. I have news from all over the continent. So much we have to talk about. So Kenya is really following the guidelines that has been put in place by the Ministry of Health. I think that is the big question tonight, this afternoon, a few minutes past 1 p.m. here in Nairobi. So some of the guidelines that have been put in place by the Ministry of Health includes using social distancing techniques, such as using telephone, video conferencing, or the internet to conduct as much business as possible, to not allow so much contact with one another, so that because that is just one of the ways that this COVID-19 is spreading, and also allow employees to work from home or to work flexible hours to avoid peak public transportation times or crowding of the workplace. And this we've seen happen in our the offices right now. You don't find a whole office of the people present, just a number, and they interchange in terms of the duties there to avoid overcrowding in the offices. And this measure indeed has gone a long way in ensuring that we curb the spread of the coronavirus. And remember also, one of the key things that the government has put in place, the Ministry of Health there, is the curfew and also the travel restrictions between Nairobi, in and out of Nairobi, and 3 other counties. And also I think right now we have Mandera has been added in that list of the counties that have recorded a huge number. Of course, Nairobi is still leading, followed not very closely, but a distance. Close the second place, there is Mombasa County, where some cases were recorded yesterday. And it is a cause of concern, especially at the KPA there in Bandari, and the government is saying that they roll out mass testing to all the workers there and the staff at Bandari. And you can imagine all these people who work there. I think that, did I hear the number is about 700 or so? You can imagine they have their friends, they have their relatives and families, and so that will require a lot of mass testing there in Mombasa, and the government will roll out that very soon to ascertain because a few cases have been reported there. Remember the guy who died in Siaya. Remember the controversial burial that took place there in Siaya. Yes, that guy also came from Mombasa, from KPA. And we also saw another lady, I think Buluma or somebody, who also died from the COVID-19 there and was buried. And so it is a cause of concern, but of course the government has taken the necessary steps to ensure the workers there are tested. And so if there's any more infections there, they will be put into quarantine and receive the treatment they need at the earliest time. So that is just one of the things. And also, as we say there, the first things that the government did after the confirmation of the first COVID case in the country, there's all the restaurants you're not allowed to go sit and eat from a restaurant. You can go order and have a takeaway. You're not allowed to sit at a restaurant. And of course, they were told to reduce the number of the staff there, which has since happened, and the bars were closed. And we saw a lot of people who enjoy going especially to the sports bars, some of them escaping families and stuff. I don't know the reason as to why. Maybe it's football is beautiful to watch when you're together and you're supporting different teams. That is the beauty, I think, of the sports. But now a lot of people have been affected, especially the men folk out there. But it is for the good of the society. So now they're back home. and people are back home, and now cases of gender violence are being really recorded from our homes, and that really is not a laughing matter. It is time to bond and to ensure that we are safe, not to fight and injure each other, because we are stuck together for the longest haul until this COVID-19 we are able to get rid of it. So promote home and stay policies for employees. So this is what the government said, that ask employees to stay at home and go to hospital if they are feeling sick, and also ask employees to stay at home if they have a sick family member in their home. So these are just some of the measures that and the guidelines by the Ministry of Health here in Kenya. I don't know where you're watching me from and what some of the things that your government have done, and you can tell me, and then we can have this conversation after I'm done with the Kenyan scenario, and then we can enter into African news just shortly. And all employers and workplaces should ensure reporting of all suspected cases among their workforce, and in turn, employers must provide mechanisms of recording and reporting their incidences to the Directorate of Occupational Safety and Health Measures. So I hope that employers in this country have been following these guidelines. And also, all workplaces should develop an infection control plan and policies to include the following details: promote and practice hygiene. Here in our office, you enter, the first thing you do, you have the sanitizer. I touch the microphone. Before I even touch it, I have to sanitize again. Anything we do, you have to sanitize, just to ensure that we are all safe. And also, the staff around here, the number was reduced by half. So a lot of our colleagues are working from home right now. This is in line with the guidelines that the government has put in place. And I think you've not been seeing Dr. Matanga here in studio. He's been operating from the political command center because of the social distancing measures. So that has worked very effectively for us here in terms of social distancing, and just in line with the guidelines that the Ministry of Health has put in place there. And also providing clean and well-maintained and hand-washing facilities. We have that here, no problem. And I believe in other areas too, I've seen a lot of, especially public facilities now, before you enter, you either have a hand-washing facility there, either in form of whatever is available there. You wash your hands, or better still, you sanitize your hand before you enter a building or before you enter a public service vehicle. So I've seen a lot of Kenyans responding to this. Of course, there's still some cheeky characters out there who still feel they could joke around with this coronavirus. I don't think they've seen the magnitude it has had across the globe. Maybe that will help them understand that coronavirus is no joke at all. And also offering alcohol-based sanitizers when regular facilities are not available. That was just in line with the safety practices and hygiene practices that the government encouraged employers and the staff and all Kenyans when you're accessing a public place, to ensure that you are safe over there. Thank you so much. And also cleaning workstations or other areas where they have been, if a person has been suspected or identified with an infection. And also limit all forms of employee gatherings. We have limited that. We only a couple of us here in the office, the essential. We are the essential workers. The rest are also essentials, but they can do their work from their homes. I cannot, because Dr. Matanga is at the political center, so I have to be here. But we've ensured that social distancing has been made possible here, and that is in line with the guidelines by the Ministry of Health. So we are hoping that also other government institutions, of course, are doing the same, and other public, areas that accommodate a huge number of people. I want to believe that they've been following these guidelines, and they've reduced the number of staff in their offices, and so that should anybody test to have this COVID-19, then it cannot spread to a huge number of people. And also provide specific protection to persons living with disabilities at the workplace, and ensure effective measures are in place to promote their safety and health. So these are just some of the directives and guidelines that have been given with the Ministry of Health here in Kenya. Like I said, I don't know where you are and what your government or the country that you are, what are some of the restrictions, what are some of the guidelines that have been put in place. And of course, it's almost 3 weeks now. They've passed by too fast. after the travel restrictions were put in and out of Nairobi. And so it was put just a few days before Easter, and that really went a long way in ensuring the curb of the spread of the COVID-19, because I know a lot of Kenyans, especially from the western part of the country, they love traveling so much. So despite the pleas by the Ministry of Health, we saw CS Kagwe every time coming in and pleading with Kenyans, please, if you don't have to travel to your villages, please don't do it. If you don't have to go send your mother some money through the phone, money transfers, we have that. I mean, Kenyans, we have that. Or if you don't have to go there unless it's really, really, really important. But we've seen Kenyans are not adhering to this directive, and so it forced the Ministry of Health and the government indeed to place travel restrictions for anybody coming into and out of Nairobi, because we know Nairobi has recorded the highest number of infections in the country, followed by, of course, Mombasa, and also other counties like Kilifi, and as well as Kwale, which also have the same similar travel restrictions. So it's very important for us to follow that. So after Kenyans, I didn't seem to care the plea being told not to travel unnecessarily, especially to the villages, because we have seen from the statistics that the older people are more susceptible into getting this COVID-19 because of perhaps the immunity is not as strong compared to the younger people. But we have also seen in the other flip side of things, we have even still more people are dying. So it's very interesting when you look at the dynamics of this COVID-19. So in short, nobody is safe if you don't keep distance, if you don't observe social distancing, if you keep touching your eyes and your face and your nose, and in case you touched a surface that has been infected, or you came into contact with a person that has been infected, you will get it despite of your age, despite how old you are, despite your level of very good immune system, you'll still get it. So just keep safe, observe these guidelines, and all of us shall be very, very safe wherever we are. So yesterday, President Uhuru Kenyatta spoke to the country, and I think I highlighted that a bit earlier on our show, so I will not get so much into that. So thank you so much. So right now, I'd like to go through, the current. Is it really current? We had this about an hour and a half ago, the statistics of the COVID-19 in Africa, and there is a possibility that these numbers have gone up because they keep changing. It is very saddening to learn that every second or every minute in the world, somebody is losing their life and is fighting for their lives from this COVID-19. That is the sad reality that we have to deal with now in the world. A very good afternoon to you, Joseph Otto Manasse. You're watching me from Denmark. I think it's still morning there, is it? Or it's afternoon yet? I don't know. And you're welcome. So let's just go through the statistics, and then we'll come and go through the rest of African news this afternoon here in Nairobi, about 1:30 p.m. here in Nairobi, Kenya. So we start with the Kenyan figures, and the confirmed cases so far in Kenya is at 303. 14 people have died, 83 others have recovered. Namibia confirmed cases is 16, recoveries there is 6. Malawi confirmed cases is 23, the death toll is 3, recoveries is 3. Sao Tome and Principe confirmed cases still at 4. Okay, this is very impressive. They recorded the 4 cases at one time, because Sao Tome and Principe is one of those countries that took a while before they confirmed their first cases, and when they confirmed their first cases, these 4 cases were the first confirmed cases, and that was 2 weeks ago, and we see they have maintained, and the numbers have not gone up. So I don't know if this is set to change in the next coming days. Probably not, but we will see. And in South Sudan, confirmed cases still at 4. I think for the last 4 days, it has been the same. I don't know if you've heard about that case about a UN worker, their staff, who left the country, and yet they had tested positive for the COVID-19. So the other staff at the United Nations in South Sudan assisted this person to flee South Sudan. Can you imagine? But United Nations has taken action against that staff. I don't know what kind of action, but I was reading somewhere they did. So we go to Uganda. where confirmed cases as at an hour and a half ago was 63, recoveries is 45. Tanzania confirmed cases is 284. All right, I'm not really shocked about this number by Tanzania, but the death toll is 10, recoveries is 11. South Africa confirmed cases is 3,635. The death toll there is 65, recoveries is 1,055. And Egypt, confirmed cases is 3,659. The death toll is 276. Recoveries is 935. Morocco, confirmed cases is 3,446. The death there is 149. And recoveries is 417. So Egypt there, the death toll is 276. So Algeria is still leading in the terms of the death toll here in Africa. And right now, the death toll in Algeria stands at 402. And confirmed cases in that country is 2,910 and recoveries is 1,204. And Central Africa Republic, the confirmed cases is 14, recoveries is 10. And Burundi, confirmed cases 11. Also, the cases there in Burundi are not going much higher, I think, because nobody really travels to Burundi that much because of the restrictions and the freedoms and all of that. Maybe has saved Burundi a lot of infections there. So one person has died and 4 people have recovered, and as I said there, the cases in Burundi still at 11. And Zimbabwe, confirmed cases is 28, 4 people have died and 2 have recovered. And in Sudan, confirmed cases is at 162. The death toll is 13. Recoveries is 14. Liberia, confirmed cases is at 101. 8 people have died. 20 have recovered. Chad, confirmed cases 33. Recoveries is 8. Burkina Faso, confirmed cases 609. The death toll is 39 and recoveries is 389. Somalia, confirmed cases 284. 8 people have died and 4 people have recovered. And the Gambia, confirmed cases is 10. 1 person has died and 2 have recovered. Cameroon, oh my goodness, the cases in Cameroon, they keep going up. Remember, Cameroon is one also in other countries in Africa, just like Tanzania, had refused to issue some restrictions in terms of even closing down the places of worship. They continued until I think 2 weeks ago, while the rest of the world were closing the churches and the mosque and the large gatherings. Cameroon was very reluctant into putting in these measures, and now we see that perhaps is one of the things that has really made the cases there in Cameroon go much up there. And we see the cases in Cameroon is at 1,163. That is the confirmed cases, and the death toll is 43. Recoveries is 397. So there's one of our viewers earlier on who was wondering why are we not talking about Cameroon and what President Paul Biya is doing. President Paul Biya has not even come out officially to address this matter in Cameroon there, and so people are wondering. But he's perhaps worried for his life because of his age. He stands more risk. And we go to Ivory Coast, and we shall talk about that. And we go to Ivory Coast. The confirmed cases it is at 323. The death toll is 3. Recoveries is 41. Ghana, confirmed cases is 1,154. The death toll is 9. Recoveries is 99. Mauritius, confirmed cases 329. 9 people have died. 261 others have recovered. Nigeria, confirmed cases is at 873. 28 people have died. 197 have recovered. The DRC, confirmed cases is 359. 25 people have died and 45 others have recovered. And Congo Brazzaville, confirmed cases is 186. 6 people have died and 16 have recovered. And in Rwanda, there we also see the cases have gone just up again. And Rwanda now confirmed cases is at 153. Recoveries is 84. And Madagascar, confirmed cases is at 121. Recoveries is 52. And in Zambia, confirmed cases is 74. 3 people have died there in Zambia and 35 have recovered. And in Togo, confirmed cases is 88. 6 people have died and 56 others have recovered. And we move to Mali, where confirmed cases is at 293. 17 are dead, 73 have recovered. Niger, confirmed cases 662. 22 persons have died and 193 others have recovered. Ethiopia, confirmed cases 116. 3 people have died, 21 have recovered. Tunisia, confirmed cases is at 909. 38 have died, 190 others have recovered. And in Djibouti, which is really shocking to me, I'm trying to understand these numbers in Djibouti and what possibly could have gone very wrong. They've, they have really recorded a huge number in sub-Saharan Africa, and confirmed cases there in Djibouti is 974. 2 people have died, 183 others have recovered, and in Guinea, confirmed cases is at 761. 6 have died, 164 others have recovered. Equatorial Guinea, confirmed cases 84, recoveries there is 1, recoveries there is 7, and the death toll there is just 1. Gabon, confirmed cases at 166, 1 person have died, 24 others have recovered. And in Libya, confirmed cases 60, 1 person dead, and 15 have recovered. The numbers of Libya has gone up. They were stuck at 10 and 11 for a very long time, and that is due to, we've seen the war that has still been active war that has been going on in Libya. Matter of fact, the only hospital, I think, in Tripoli that still was able to treat people, I think, was bombed about 2 weeks ago. So that really greatly affected and hindered even the efforts to carry out the test there in Libya. But now we see the numbers have gone up. So are we likely to see the numbers go higher than that? Yes, I think there is a high possibility, because perhaps we see now, perhaps they've started aggressive testing there of individuals. They are in Libya, and the confirmed cases, as I said, there is 60. 1 person has died and 15 others have recovered. Mozambique, confirmed cases 41, recoveries there is just 8. And Seychelles, confirmed cases 11, recoveries is 5. And Sierra Leone, confirmed cases 61, recoveries is 6. Benin, confirmed cases is 54. 1 person has died, 27 others have recovered. Eritrea, very interesting there, the figures still remain low. Confirmed cases, because really, people hardly visit Eritrea. That could be one of the reasons why. And also, I don't know, there has to be other reasons. Recoveries there is at 6, and as I said there earlier, the confirmed cases in Eritrea is 39. Guinea-Bissau, confirmed cases is 50, recoveries is 3, and Angola, confirmed cases is 25, and 2 people have died, recoveries is at 6. And President Alpha Conde took advantage of this COVID-19, I think that was it 3 weeks ago, and he continued to carry out that very controversial referendum to change the constitution to allow him time to run for a 3rd term. His second and last term is supposed to be ending this year, but he thought, you know what, I will extend it, because you know what we do in Africa, we just have constitutional coups, and all is well. And we look at the statistics in Africa so far. I don't know if the production can bring that back here, because I think what I have so far of the confirmed cases was prepared a bit a while ago, so there's a possibility those figures have changed. So I'd like to just read that from what our production has updated there for us, so that I make sure I capture the right thing there. Samuel Chaga, I see you. Good afternoon to you. John Clark, nice to see you today. Thank you so much for watching, and the rest of you, please let me know where you're watching us from. I don't know if that is ready, but yes, confirmed cases, there we have it. Confirmed cases globally right now stands at 2,639,243, and the recoveries is at 715,734, and the death toll is at 183,820. That's a lot of people who have died. And confirmed cases in Africa is at 25,950, and recoveries in Africa 6,970, and the death that has been confirmed so far in this continent is 1,240. Thank you so much, their production, for bringing us the latest figures there from across the world. So of course, the total confirmed cases, as we have seen there, is now it has gone very up, and that represents, the death toll represents about 6.97%. Is it 6.9% of the total number of confirmed cases across the globe? So I will not get so much into this other countries, but because I know the figures have changed. We prepared this about a while ago before we experienced that technical hitch, and so I will not get into this here. I know in Africa it doesn't change a lot compared to a country like France, Portugal, US, Italy, Germany, India, UK. We see the figures changing all the time. So if I read this, it might not be very, very up to date, so I'll just leave that alone. But thank you so much. Yes, I see Stephen Maura, you're watching from Nairobi. Maura, how are you? Are you well today? Are you keeping warm? Because I know it's very cold here in Nairobi. Kim Adrico, you're saying you're watching from Uganda. Thank you so much. And John Clark, UK, social distancing restrictions to stay until end of year, with schools set to remain closed until at least June 1st. Oh, that is from the United Kingdom. John Clark, look at you helping my neck out. Thank you so much for that update. And the rest of you, if there's anything out there I need to know, this is Diaspora Dispatches. So here what we do is we engage each other. You let me know what else is happening out there, and I'll let you know what is happening here. All right. And in that regard, let's just start. And we start with Ethiopia, where the World Health Organization has warned of a yellow fever outbreak in Ethiopia. The number of suspected cases has increased from 3 reported on 3rd of March to 85 on the 6th of April. 8 of the suspected cases have tested positive. Vaccination has since been reactivated by World Health Organization is concerned, but World Health Organization is concerned about the outbreak in cases with no travel history. And we go to Tanzania, where Tanzanian opposition leader Zitto Kabwe has warned the government against giving false hopes as the coronavirus cases in the country rise significantly. Mr. Kabwe said citizens need to be told of the true picture of the pandemic, and the country confirmed 13 new cases on Wednesday, pushing the total to 284 cases, and 10 deaths have so far been reported in Tanzania. The Tanzanian Prime Minister Kassim Majaliwa on Wednesday urged citizens to trust the government and its medical experts in the fight against the coronavirus. I don't know if I will do that, but you know. Mr. Majaliwa said the government has to assess every measure before imposing stricter rules to curb the spread of the virus. Religious gatherings are still allowed in the country, and President John Magufuli is on record saying coronavirus cannot survive in the body of Christ, encouraging people to pray and attend church. Mr. Magufuli, you have to change this now. This is not the time. Even Pope could not celebrate the Easter Mass as he normally does. And you were a staunch Roman Catholic, and so your leader could not do that. So I don't know what reason you still have to keep those churches open. St. Peter's was not open on Easter. Can you imagine? Because it was important, and that was the Pope. So I don't know what is it that it will take. So Tanzania, even after recording these high numbers there, the country has not really banned any form of gathering, in religious gathering. So I don't know what Mr. Pombe Magufuli there is trying to. I don't want to say he's trying to prove, but I don't know. Maybe he'll change his mind. Who knows? Abraham Wangila, you're watching from Kitale. Nice to see you. I haven't seen you here in a while. All right. So another news from World Health Organization. And the head of the World Health Organization has warned of worrying upward trends in coronavirus cases in Africa, Central and South America, and Eastern Europe. Tedros Adhanom Ghebreyesus told a video news conference in Geneva that while most of the epidemics in Western Europe appeared to be stable or in decline, for many countries the disease was just getting started. Mr. Tedros said some countries which had appeared to do well in the initial stages of the pandemic were now seeing an upsurge in cases. Most countries are still in the early stages of their pandemics, and some that were affected early in the pandemic are now starting to see the resurgence in cases. That is what Mr. Tedros saying. I was just reading a quote there. And we move to South Africa, and I don't know if you agree with Dr. Tedros. Right now he seems to be in a very hot seat because the world, as much as the world will deal with China after this is done, I believe. And people are really blaming China, but also the World Health Organization is taking a huge chunk of that blame because they did not really warn the rest of us earlier enough. And it appears, according to Trump, and if you look at the whole thing, Trump really is the one person I don't agree with in a lot of things, but on this one, seems to be having a lot of point because he says that World Health Organization seems to be playing into the tune of China. All right, China seems to be paying the piper there. So World Health Organization did not do its job. It failed the whole world. So I don't know what you think of this, and this is a conversation that we've had here, especially Dr. Matsanga is very passionate about this, me as well. So let me know your thoughts on this. So they're coming out and they're telling us, you know what, Africa, your cases are a bit low right now, but brace yourself for more cases as there will be a spike. I don't know, you tell me what you think. Now we go to South Africa, and the South African's communication minister Stella Ndambeni has admitted to failing to follow the lockdown rules and has paid a 1,000 rand fine that is equivalent to around $53 as ordered by the senior magistrate in the Tshwane District Court. Now, the National Prosecuting Authorities, Pindi Mujonondwane, said the minister's court case proves that all citizens are equal and no one should break the law. That is very small fine. $53. The fine is meant to be heftier than that so that it deters, especially a whole minister. And the minister was pictured at a former colleague's house having lunch during an ongoing lockdown aimed at reducing the spread of the coronavirus. The minister was summoned by President Cyril Ramaphosa and was placed on 2 months special leave. What do you mean? Is she still being paid? I don't know. So we move to Djibouti, and Djibouti has recorded another sharp rise in coronavirus cases on Tuesday. It reported 99 new cases, bringing the total number of confirmed infections to 945. Mass testing has been greatly hampered by heavy rains and floods, which have killed 8 people in the capital. Now, the country, which has a population of under 1 million, has reported more than 200 new infections in the past 2 days. All right. The population is under 1 million, right? And has reported more than 200 new infections in the past 2 days. Okay. Now, 2 people have died so far. The reason for the spike is not yet clear, although experts say the tiny nation is conducting more daily tests than its neighbors Ethiopia, Somalia, and Sudan, and even Kenya further south already. And then we go to Uganda, where 6 Chinese nationals have been convicted by a Ugandan court for escaping from a hotel in capital Kampala, where they were quarantined. The Daily Monitor newspaper has reported the group who was arrested last month, together with a Ugandan driver and his wife, on their way to the neighboring Democratic Republic of Congo, according to local reports. They had not completed 14 days of mandatory quarantine at the hotel. They pleaded guilty on Tuesday at an open-air court where they were charged with disobeying lawful orders. The newspaper reports they will be sentenced on 4th of May. So these are Chinese nationals, right? They were put under quarantine in a hotel. Lucky them, because that is not what is happening to our African brothers and sisters right now in China. There's not even a single hotel that is allowed to have them in their facilities. But here, we are cashiers. And we see even in Uganda, the government of Uganda is very courteous. So they were put in a hotel for self-quarantine after they came into the country, treated very humanely. And so they still have a nerve, these 6 Chinese, to leave at the hotel before even the 14 days mandatory quarantine was over. So look at that. It's very interesting there. So they are waiting their sentencing on 4th of May. And I would like to see how that will play out there in Uganda. I know President Museveni does not really play when it comes to certain things. And we go to Morocco, where police in Morocco have arrested more than 3,000 people in the past 24 hours for breaking restrictions imposed to combat the coronavirus. What is wrong with us? More than 3,000 lawbreakers in 24 hours. Now, more than 50,000 people have been arrested in the country since a nationwide lockdown was introduced in mid-March, and wearing a mask outside the home became compulsory. There are 3,377 cases in Morocco, making it the third worst hit country on the continent. Look at that. And then people are still walking around without the mask and still breaking, not adhering to the measures they are put in place by the Moroccan government. And we move to Madagascar, a story that I find to be very interesting. Madagascan President Andry Rajoelina has officially launched a medicine he believes can prevent and cure patients suffering from the COVID-19, developed by the Malagasy Institute of Applied Research and branded COVID Organics. Now that sounds like something I'd like to take. President Rajoelina presented the so-called remedy to the press on Monday. It contains Artemisia, a plant cultivated on the Big Island to fight against malaria. Now, a presidential, I know we're all trying to find a solution, but come on. This plant is meant to treat malaria. Yeah? And so a presidential decree say the COVID organics is mandatory for children returning to school on Wednesday. That was yesterday, I believe. And President Rajoelina said on Monday that it had cured 2 COVID cases. Look here, Africa, we have a solution. It is in Madagascar. And there you'll go and you'll be given COVID organics. This is quite a story. Let me know what you make of that. You're saying Botswana. Are you in Botswana, Christian Chinasa? But how safe is that? I don't know. Oh, Joseph Otto, you'd already shared that story. Are you saying you'd already shared that story? So let me know what you think of this in Botswana. Why is King loaded there? President... no, that is in Botswana. In Madagascar, President Andry Rajoelina has officially launched a medicine that he says can prevent the COVID-19. It is called COVID Organics. It comes from a plant it contains Artemisia, and from a plant cultivated on the Big Island, and usually it's used to fight against malaria. But President Rajoelina there of Madagascar is saying this COVID Organics is mandatory now. If for any child who has returned to school since yesterday, they have to take this COVID Organics. Some wonderful news there. But they have not even tested it. But he's saying that 2 people have been cured from this. Maybe we need to try. We need to go back to our roots. The herbal way. So let me know what you think, if this is something that you could take. And some other news is that ECOWAS, the Authority of ECOWAS Heads of State and Government, will be holding an extraordinary session through video conferencing to discuss the impact of the COVID-19 pandemic. ECOWAS Secretariat, in a statement, said the virtual meeting is scheduled for April 23rd. I think it happened today at 10 a.m. Universal Time. The heads of state will be discussing the situation and impact of the coronavirus pandemic in the ECOWAS region. And preceding the summit, France ministers and the governors of central banks across the region held a virtual extraordinary session on April 21st on the COVID-19 situation. And then we move to Nigeria, where 72 Nigerians awaiting evacuation in Guangzhou City, Guangdong province of China, have tested positive for the coronavirus disease. Now, the results of the test conducted on 56 Nigerians, which were released on Tuesday, indicated that the infected individuals were asymptomatic, raising concern that they might have infected other people. It had learned that the 16 Nigerians had earlier tested positive for the virus, bringing the total number to 72. This is a bit confusing for me. Are they not the same people who are still out there in the streets in China, I believe? And now they've tested, now 72 Nigerians have tested positive for the COVID-19 there in China. Interesting. And then we move to Cameroon, where President Paul Biya acknowledged that soldiers killed 3 women and 10 children in February massacre that they then tried to cover up by torching houses and blaming Amazonians. BS office released a statement on Tuesday saying 3 troops were arrested for the killings in the northwestern village of Garbu. Several other troops were expected to face disciplinary hearings for the killings, which led to at least 600 of the villagers to flee the capital in Yaoundé. And some news from Biafra. I know it's been a while. And the leader of the indigenous people of Biafra, Nnamdi Kanu, says the death of Abba Kyari has 2 major implications in Nigeria. Remember, President Buhari's right man there. So Niger News had reported earlier that Abba Kyari, the chief of staff, yes, he was the chief of staff in the government of President Buhari, to the president, died of the coronavirus on Friday, April 17th. Now, reacting to the death, in a tweet, Kanu, who is in exile in United Kingdom, said the first implication of Kyari's death has on Nigeria is that the country has lost her de facto president. And number 2, he added that the next implication, the second implication in Kyari's death has on Nigeria is that the billions allegedly stolen by the former chief of staff may not be recovered. If you're watching me and you are from Nigeria or you are Biafran, the death of Mr. Kyari, according to Nnamdi Kanu, the leader of the people, indigenous people of Biafra, he says Nigeria has lost its president. How many presidents do we have there? We have one who is said to be Jibril, and now this one, apparently he was the one who was in control of the government, who's a very powerful man. That is true in the government of Buhari. So he seems to be the person who was pulling the strings in the government there of Nigeria. So now he's dead. So Mr. Nnamdi Kanu is saying Nigeria has lost its de facto president there. And number 2, it is sad because now Nigeria will not be able to get the money, the billions that Mr. Kyari seems to have taken there while he was still alive from the government. Okay, I also want to know your thoughts on that if you're watching me and you're from somewhere over there. So Abraham Wangila, I'll read your comment in a while. I've seen azithromycin there. Is that another treatment? So now we go to South Sudan, and I know it has been very quiet, but the latest news from South Sudan is that the Minister of Defense and Veterans Affairs, Angelina Teny, and if you didn't know who that was, that is the wife of the first vice president of South Sudan. It has 5 vice presidents. So the first vice president, Dr. Riek Machar, this is the wife. I don't know who thought it was a good idea for both the husband and wife to work together in the same government, just as President Museveni and his wife is the Minister for Education there. Very interesting things that happen in this continent. So now, the Minister of Defense and Veterans Affairs, Angelina Teny, has declined to appear before the Parliamentary Committee on Coronavirus, saying the current parliament has no mandate. Listen. Now, in a letter dated 16th of April 2020, the first Deputy Speaker for Parliamentary Affairs, Timothy Todd, indicated to the Minister of Defense that the Parliamentary Committee on Coronavirus had decided to summon her to appear before the committee on 20th of April 2020 at 11 a.m. in the premises of the Transitional National Assembly. And so in the letter, it said the Transitional National Legislature of Task Force in its meeting first dated 7th April 2020 discussed the impact and challenges in implementing the preventative measures to combat the spread of the COVID-19 in the country. Among these challenges, one is identified and falls under your jurisdiction. That is the jurisdiction of Angelina Teny, who is the Minister of Defense and Veterans Affairs. Are we together until that point? All right. And that in a huge number of people are still crossing into South Sudan, causing high risk to the lives of the people. As you know, South Sudan is one also the countries that confirmed their first cases a bit late. And since the confirmation, there's only been 4 cases. But now, according to this committee, the Parliamentary Affairs, we led by Timothy Todd, they're saying there's still some people who are allowed to come into South Sudan. And remember, South Sudan put some restrictions on its borders there to just help curb the spread of the COVID-19. And so apparently this falls under the jurisdiction of Angelina Teny, who was called to appear in front of this committee and explain why, and she did not show up. All right. However, in a letter seen by iRadio, Angelina declined to appear before the committee because she argues that the current parliament has no mandate to extend its life. She said, according to the agreement, the current parliament is supposed to be replaced by the constituted TNLA by the end of the pre-transitional period. Oh my goodness. This is a hardened wife married to a hardened husband, and they form part of the leadership of South Sudan. And now, in the middle of a crisis, we still see here a bit of chest thumping, which I don't think is very necessary there in South Sudan. Whatever her response is, I know she's saying that this current parliament has no mandate to extend its life. And I think it's supposed to be in until the elections are done, and elections has not been done. And so the parliament that is there is what is there. So now for her to refuse to, I don't know, does she has a point? Does her argument hold any water there? Oh, by the way, that is the latest from Africa this afternoon. I know there are other things that perhaps have come up. You tell me. Does Madam Angelina Teny here has a point when she says that when she declined to appear before this parliamentary committee to explain as to why there's still some people who are being allowed to come into South Sudan even after restrictions were made in terms of the people who can access the borders of South Sudan because of the high risk that comes of the spread of the COVID-19. And this falls under her jurisdiction, but Madam Angelina Teny there came out and said, no, I will not appear on that in front of that parliamentary committee on coronavirus. One, because the current parliament has not mandate to extend its life. Is it the right time? She did not even explain why. I think even after all of that, she should have said, okay, perhaps answered even that question that the committee wanted to know. Because if this falls under your mandate, Madam Angelina Teny, and you're being told under your jurisdiction that people who are accessing, South Sudan, who are posing a risk and could, see the cases of the coronavirus go up in the country, and that is the last thing you want to see happen in South Sudan, for heaven's sakes. And this falls under your Ministry of Defense and Veterans Affairs, and now you're trying to bring politics to where it's not even supposed to be, instead of responding and saying, is this what is happening or not? Because you're still the minister, whether that parliament is still viable or not, whether that parliament life shelf has expired or not, but still as the minister, and this falls under your mandate to ensure that the borders of South Sudan are safe and the measures and the directives that have been given by the government are followed, the government which you work for. You still, I think, owe the people of South Sudan an explanation and tell them, okay, this is what is happening. Perhaps maybe it's a case or two or whatever. Because we see it's from South Sudan that a member, a staff of a United Nations staff that had tested positive for coronavirus was airlifted in conjunction with other staff members from UN there in South Sudan. So it is very important. These are, I think, very pertinent questions that this committee wanted to answer. And if you felt you could not appear in front of this committee and answer all these things because you feel that the parliament has no mandate, the committee has no mandate to call you and to be answerable to them, you should have explained under, you're a minister, so you should have at least responded to that, only that part. Don't appear then if you don't want to, which I don't know. But at least you should have explained and just clarified that matter. These concerns they're raising here, I think, are very important, and you should not just bring politics into this matter. I don't know. This leadership in South Sudan, Madam Angelina Teny, come on now, you can do better than that. That is the wife of Riek Machar. You can do better than that. So there you go. She's very stubborn. I see you're saying that she's very stubborn. I mean, she's married to Riek Machar. What do you expect? And that's a very, I don't know. That is the kind of household you don't joke around with there. So you're saying, Abraham Wangila, I have been sick for the last 1 month. Thank you. Oh, really? I pray you get well. I thank God you're well now, and welcome back. And Freedom Biafra, you're saying good morning, Miriam. It is afternoon here. Matter of fact, just a few minutes past 2 p.m. Joseph Otto, you're saying Denmark has opened schools from nursery to primary 5 first phase. We saw that some news, but I know over there there's some order there, so that's some very good news. And Joseph, thank you so much for watching. Christina Chinasa, you're saying really, but how safe is that, you're asking? And I think Joseph answered you there. And Abraham, you're saying Mauritania, it had 7 COVID cases, 6 recovered, 1 succumbed. It has been testing, but no new cases yet. That's very good. That's very good there. So what, Mauritania, they found a solution? Like this one, Madagascar has, President Rajulina there is saying they've made the COVID, they're calling it the COVID what? Perhaps they should give to the rest of us. Yes, it is called COVID organics. It is made from some plant there that is used to fight malaria, and they're saying now this one can be treated. COVID organics is the way to go for the people of Madagascar. I don't know why I find it funny, but he said that it has already cured 2 cases. First of all, you don't cure COVID-19. It's a virus. Yeah, there's no cure for it. I don't know, it just disappears from the body. I'm not sure, but there's no cure for it, but you get better somehow. Madagascar might be right. Oh, Abraham, you're saying all the artificial drugs under clinical trials are malaria medicine except remdesivir. Hey, my son has been really trying to say this name. He's been trying to bring it up to me. I did not even understand what he's saying, which is a drug for Ebola. Okay. And azithromycin, hydrochloroquine, and chloroquine are all malaria drug, and Artemisia has efficacy that treats malaria. Viva African brothers. Oh, that's very good. And thank you there for that. I feel like I just gone to school. Thank you so much, Abraham, for that information. And of course, President Rajulina there said that every child that is reporting back to school has to take that. It is mandatory now. So all kids will be well there in Madagascar. So Joseph, you're saying, I'm thinking of neem tree in addition to Madagascar. Is this Marubani, that one that treats all the diseases in the world? And somebody was telling me about this yesterday, and is it yesterday or today in the morning? We were having that conversation here in the office. Actually, matter of fact, you never know, a solution might come from African organic richness. All right. And Gabrielle Kuono, you're saying, yes, she has a point and she did exactly explain all she did. This is Angelina Tenny. You believe she has a point on why she could not appear to the committee and explain why people are still accessing South Sudan even after a directive was given not to. So, all right, Gabriel Kwano there, thank you. And Angelina Otto, you're saying, Joseph Otto, you're saying Angelina Tenny should frame up. That is stubbornness. She wants to be a defense minister of dead people from COVID-19. Oh my God. I hope not. I hope not. So thank you so much for your time there. And of course, other news across the world. And as I mentioned there earlier, the people, remember that the killings that happened in the Anglophone region in Cameroon a few months ago, in February, as a matter of fact, that we saw women and children being killed there. So President Paul Biya came out and said that, acknowledged that actually those killings were carried out by the army of Cameroon. What a shame there. And now I've seen a lot of international bodies coming out and really condemning this and asking President Paul Biya to take action against these soldiers. I don't know if this is something that will happen. I'm not sure there. And also in Biafra, as I left there earlier, Mr. Nnamdi Kanu is saying now that the Chief of Staff of President Muhammad Buhari, who died on the 17th of April there, remember the burial where people went and did not even observe social distancing. And I want to believe all of those people have been put through self-quarantine or mandatory quarantine, because that was not very good. That went against every directive by the Nigerian government itself. And so Mr. Kanu is saying this person, it appears now that he was the de facto president of Nigeria, and now that he's dead, apparently Nigeria does not have what they have now. It's just, a formality. And also say that it is sad because Nigeria, the billions allegedly stolen by the chief of staff will not be recovered. And so that is that. So thank you so much for, and these cases in Nigeria, 72 Nigerians are awaiting evacuation in Guangzhou City have tested positive for coronavirus cases. Yes, remember the Africans who were seen being thrown out in the streets there in China. I don't know why I'm finding troubles accepting that. Is it because who is carrying out this test? China. Who threw these people out in the streets? China. They could be trying to, I know, there's a possibility they are sick, but they could be trying to justify the reasons as to why they threw these people out in the streets. And if these people have tested positive for coronavirus, then the best thing you would do is, allow them treatment and keep them in places that are okay, not throw them out in the streets. I'm still trying to be very diplomatic about this matter. But as an African, this has not made me very happy. And so, and also in Tanzania, we see the government right now is coming out. Opposition leader Zitto Kabwe has won the government, and I saw the Prime Minister in Tanzania come out and say Tanzanians should have faith in the government. The government is doing all it can to ensure that they are safe. I'm not sure about that from what we've been reading, because we've seen the numbers in Tanzania skyrocket because initially they only had very few cases, and for the past 3 or so days, we've seen the numbers go really up. And right now, Tanzania has 284 cases, and 10 deaths there have been reported from that country. So I'm just hoping that this will be a wake-up call to President Pombe Magufuli there in Tanzania, and he should, take the measures that are effective and with swift, so that to avert more, infections of the COVID-19 and ensure that Tanzanians are safe in their country. Thank you so much for your time. This has been Diaspora Dispatches. We shall meet here tomorrow, hopefully for another edition. And later on in the evening, you can join Dr. Matanga with another show. Yes. Kongaki saying, I believe closing borders is a work of police. Why are they blaming Angelina Teny? The reason why they're blaming Angelina Teny, sir, is because she is the Minister of Defense, and what else? Let me just get the titles correct. So that falls squarely in her docket. She is responsible for that. Closing the borders is the work of the army. The borders of a country, that is the work of an army. When it comes to the borders, the army there, together with the police, of course, but usually, yes. So, yes. Where is that story from Uganda, from South Sudan? But at least she should have, as much as she felt as though, the current parliament has no mandate, and the people calling her to answer to them has no mandate. But at least I don't know. You don't think she owed an explanation to South Sudanese, and maybe acknowledge if that is happening, or say no if it's not happening? You don't think? She should have offered an explanation to the people of South Sudan. If she did not want to go offer an explanation to that committee, she should have told South Sudanese what is really happening. But anyway, Joseph Otto, you're saying Magufuli radicalism is going wrong if he's not very careful. All right, thank you so much. So I'll see you here tomorrow for another edition of Good Morning Africa, and we shall talk about other matters that affect us in the continent. Enjoy yourself. Have yourselves a good afternoon, or a good morning, or a good evening, depending on where you're watching us today. Bye-bye for now.
must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.